Welcome to The Holistic Nurse with your host, Peggy Smith. Peggy will introduce and educate her viewers about the differences between alternative, holistic, and complementary medical therapies. Her goal is to empower the lay medical consumer to learn how to advocate for themselves. So now, please welcome the host of The Holistic Nurse, Peggy Smith.
Hi, everybody. Welcome to this week's edition of The Holistic Nurse with Peggy Smith. Today's show, we have a guest who will be joining us shortly, but it's sort of a sequel to a show that was done on her YouTube page yesterday. It's medical intuitive Dr. Gloria Warren, and we were talking about how she identifies and treats autoimmune disorders. So until she joins us, we're going to just talk a little bit about what autoimmune disorders are. I think I mentioned yesterday's show that if you have one autoimmune disorder, you've probably got 5 to 20 of them. It's a condition in your body where your body's immune system accidentally attacks its healthy cells, tissues, or organs. Examples would be type 2 diabetes, asthma, fibromyalgia, chronic Lyme, multiple sclerosis. Cancer is really an autoimmune process because the cancer cells are attacking your healthy cells. And there's hundreds of them. And so it can be quite problematic. And sometimes, depending on your medical provider and access to services, as our ever-changing health environment is changing, some of our holistic and complementary choices actually help you manage the symptoms. We're not going to cure anything, and we don't cure anything in complementary medicine, but we can help with the management of symptoms. Another one that's very common is Crohn's disease and ulcerative colitis. Graves' disease, that's a thyroid-related problem. And celiac disease is also an autoimmune. Um, and of sorts, even Lyme disease falls in that, even though that has an origin from a tick bite usually. But the post-Lyme treatment syndrome is what, qualifies for that. So one of the most common ones is the fibromyalgia and also chronic fatigue syndrome. And we all know somebody, if we're not experiencing it ourselves, what fibromyalgia is. It's a chronic condition that has a widespread muscular pain. You're often having trouble sleeping, very exhausted. Sometimes it's called fibro fog, which is similar if you've ever been in cancer treatments or known somebody who was. Chemo brain is a similar term that describes the same phenomenon. And you just have difficulty with memory, concentration. You have no energy. You're not getting any sleep. So you either can't fall asleep or stay asleep because the symptoms, the pain and discomfort wakes you up. Restless leg syndrome sometimes is part of it. You're just increasingly more sensitive than most people to everything, and especially when you're not able to get the sleep you need, it just feels like your body really is attacking you from all angles. Chronic fatigue syndrome, it has a fancy name. It's called myalgic encephalomyelitis. It's a debilitating long-term illness that's also, as it says, chronic fatigue. A lot of these autoimmune systems and symptoms go across the spectrum of almost all of the autoimmune. To get the diagnosis chronic fatigue, your symptoms usually last 6 months. It's not alleviated by rest. Physical or mental exertion seems to make it worse, just stress in general. Again, you have that brain fog issues, and that may not be caused by the chronic fatigue, but it's probably caused by the symptoms of not getting the rest and hydration. And you're oversensitive to lights and chemicals. And traditional medicine offers sometimes intravenous infusions that have to be done as much as every 2 weeks to every 6 weeks. There's a variety of them that specialty pharmacies offer. You used to have to go to an infusion center. Many patients can get them at home, but they're also very expensive, sometimes difficult to get your insurance, if you have insurance, to provide it, and very few people can afford it without insurance. The exact cause, though, of the chronic fatigue syndrome is again multifactorial. It's somewhat genetic. We're just going to take a brief break so Gloria can pick up where I gave you this quick introduction, and I'll introduce you to medical intuitive Dr. Gloria Warren. We'll be right back.
What if there were a super tiny device that could diagnose the brain and is smaller than a single human hair? What if you could see inside the brain to help an epilepsy patient during surgery or to help the fight against Parkinson's disease? Dr. Patricia Broderick is proud to announce the Broderick Probe, a biomedical and electronic breakthrough. Imagine a probe to help with the understanding and potential cure of brain-related diseases. To learn more, listen live to the Easy Sense radio show with host Dr. Broderick, Wednesdays 7 p.m. Eastern on the Bold Brave Media Network and TuneIn Radio. And to help support the Broderick Foundation, please go to EasySense.com and learn how, with your help, we can fight these horrific brain disorders. That's EasySense.com to learn more and help support the Broderick Foundation. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness, Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals. Listen to John Hawkins' My Strategy, Saturdays, 1 p.m. Eastern on the BBM Global Network and TuneIn Radio.
Hi, everybody. We're back. Sorry for that brief delay. I'd like to introduce at this time Dr. Gloria Warren. She is a medical intuitive, has an extensive medical background in general, and she'll share a little bit about that, and we'll move on. Welcome, Gloria. Glad to have you.
Thank you so much for having me. Yes, and definitely medical intuitive. I've been doing that since I was in high school. I mean, Lord knows how many years that was. But yeah, I'm a certified epidemiologist through Johns Hopkins University School of Public Health. My medical classes were at Stanford and New England College of London. I've worked in laboratories. I've worked in pharmaceutical research. I was there for many years. Just a whole conglomerate of all this medical scenario that I've actually applied to my medical intuitive readings and to help people. You know, it's all about helping people for me. So to me, that's very important in life.
So, and we were talking prior to the show about how sometimes the traditional medical treatments, if they cure or relieve the symptoms at all, they take a long time. Can you talk a little bit about why some of our alternative choices seem to make the clock go faster and actually help?
Right. Well, you know, it's all about self-sustainability. And what I mean by that is we need to really think holistically. And if you start to notice something isn't quite right, you need to figure out or see a medical professional, an herbologist or an herbalist, and see what would actually help with that specific type of symptom. And perhaps they can treat the root cause of the problem. That's where I come in. I show them the root causes and everything. I'm also an herbologist, so it helps. But the difference between Western medicine, Eastern medicine, and holistic, more herbology type medicine is that, or Ayurvedics even, is Western medicine works fast. And we really need Western medicine. I'm the bridge. I'm not one that believes that, oh, you can do it all holistically. No, you can't. You break an arm, go get it set. You need surgery, a tumor removed, please just remove the tumor and go from there. It works great. Holistic medicine works great as a complementary to Western medicine. And sometimes just holistic medicine is enough. So it's just in the knowing what's what. Where do I go? Simplified or not? The thing though with holistic medicine is sometimes it can help right away, like ice. That's holistic. Ice on a sprained elbow or something. Or something just quick, easy, but it's not usually like that in some holistic medicine, like when you deal with herbology. Herbology can take a little longer. So you really need to know your norm. What is your norm? How is it? Why is it you feel this way? How is it you feel this way? And why do I not feel good right now? You need to be able to analyze yourself. In self sustainability, that's what I help to teach. Knowing yourself so you know which type of medicine you need. So just like you need that care that you offer. It's very important in life, in many different stages of life. And same with me in epidemiology. I need to be able to see, if autoimmune diseases start popping up everywhere. Okay, the first thing I ask is what's the pH of their drinking water? pH makes a huge difference and impact on the human body and skyrockets autoimmune diseases. So what are the heavy metals? That's another thing that can skyrocket autoimmune diseases. So it's just in the knowing, and that's why we have a whole conglomerate of different types of medical professionals. And I always recommend that you see your medical professional before you try anything on your own. But at the same time, you have people like us that can help guide you to the right person or the right type of medicine, whether it be Eastern, Western, rainforest medicine, Native American medicine, whatever you need.
Well, I'm an RN, and so I'm kind of in a unique spot on the bridge that I have to still protect my license. But when I was going
Hmm.
through cancer treatments, I combined Western and Eastern. I got the surgery and the chemos and radiation that were prescribed,
Yep.
but the alternatives treatments are very good at managing symptoms. I didn't need to use opioids for pain management because I learned a lot of techniques that work. I don't tolerate pain medicine anyway. Tylenol will knock me out. But
Right.
at least on the East Coast, I don't know if it's nationwide, maybe in the big cities, most of our medical schools now are actually teaching the new interns and residents, and they call it integrative medicine. They can charge a
Right.
little more if they're an integrative medicine doctor. Um, but like the local hospitals here, they all have a holistic department where a nurse will come down and give you a Reiki treatment if you need that. Um, and we when we're learning and studying Reiki, sometimes it's presented as a first aid kit in your pocket that you don't need any physical things. Yet we also learn that if you have a fracture, Reiki is not the treatment to choose because your bone will
Right.
heal incorrectly and too quickly.
Yeah.
So we're not just reading comic books. This comes from centuries and centuries of you know ancient experience. Most of our
Hmm.
modern medicine comes from herbalist background,
Right.
uh, and so I always caution people with the herbalism. If you're taking prescribed traditional medicine along with the herbs, you need to let both providers know, because even the
Yep.
alternative herbalists will know which traditional medicines interact. You could
Right.
get toxic levels of maybe a seizure drug that you need because it interacts with something.
Yep.
Uh, and I don't know if you'd like to go into just real briefly what you did for me yesterday with the way you do an intuitive treatment. You don't have to go through the whole
Right.
scenario. Just explain how a treatment works, and that's your baseline that you start with.
Well, it's various things happening in me when I do a medical intuitive reading. I did a very short medical intuitive reading on you, but what I do is I use my intuition, my God-given gift, and I hone in on that as well as I use remote viewing. The government uses remote viewing very often actually to help with major scenarios in the government. Um, I do it a little differently. I was raised differently. So when I see remote viewing, I actually see inside, and people they don't understand that. But sometimes I'll even see implants and things like that. And uh, I start on the basics, and then I expand and I try to see inside. A full medical intuitive reading, I see a lot of things inside. A mini reading, it's more of an exterior type, and then certain things inside. But I think I basically go through the problem areas, the uh, resolution, is the main thing, and the root causes. So I try to help them different ways. I tried to guide them to the right healthcare professional. And then I entertain, please, by all means, bring it to your doctor. I'll talk with your physician. It's very common. I do talk with physicians here and there. And, unfortunately, we are human beings in the sense that we all can't know everything. And we need to realize we need each other to support society today in many different ways. So, just something to think about. One thing you didn't mention, and I just want to mention it while we're here. A lot of people with herbal medicine, they think, oh, this is it. That's all you need. And let me tell you right now, I wish that was the case, but um, unfortunately, they don't think that a lot of people don't think that herbal medicine has negative adverse effects. And it can. All herbs have negative effects when taken too high of a dose or for too long period of time. I'll give you an example. Like, anyways, they all do. And I'm in the middle of writing these books right now, and I just finished the medieval herbalism, and I'm writing one on the Druids, writing one on Egyptian herbalism, and there's wonderful stories about the monks. The first one that come out is the one on the monks in the medieval times, and the monk stories are so um, inspirational. And just to learn on how they use this in their time, and they were seen as the medical practitioners of the day. So, but I am also trying to put down the negative effects of each of those herbs at the same time. So we really need to think of that. There's no one-stop shop, and there's always a negative effect to anything. Put too much ice on an injured knee, you're going to cut off the circulation and hinder the healing process. So, there's always a negative effect for everything, even Ayurvedics. So, but
Well,
positive
I guess
effects
it kind of
everywhere.
goes back to just everything in moderation,
Right, right.
and common sense, which, seems
Hmm.
to be hard to find in many areas of our life right now. Um, do you
Yeah.
find that, since it's a growing topic, does artificial intelligence in any way help or make it easier or harder for what you do?
Well, artificial intelligence, I've done so much with artificial intelligence over the last year and maybe actually the last 3 years. It's been out for many years, actually. Um, but it's been brought to the public's eye over the last year, obviously. Artificial intelligence is a good place to get an idea, like what topics can I use on this herb, or what herbs can I use on this topic. However, you got to keep in mind it's still in developmental phases, and a lot of the information on artificial intelligence is not accurate. So if you're going to use artificial intelligence in medicine or for calculations, like I'm doing now for my company, Sustainability Management Institute, we're doing accounting. So, how to measure that complete life cycle. And some of the calculations I found were incorrect. And so then I look at the EPA and I go to that part. And so I have to edit and I need to review it. And I have an EPA expert to review those type of things specifically. So, you need the experts on your side to really review and edit and know when things just aren't right. There's some tendencies, if you like to hear it, on what artificial intelligence does incorrectly and correctly. It can give you ideas, obviously, but incorrectly it can substitute things that don't belong in your list and instead of something that should belong in your list, and that's where the expertise comes in. So
Whenever I've attempted to, request something from AI, I always ask for their sources at the end
mhm,
of what I'm asking for, and then I go back, the old-fashioned way and search the resources. And so far, I've been lucky. Most of my sources that they were using are valid sources, but
right.
I'm not looking for outlandish, crazy ideas. Um, so, with the autoimmune, thing, do you have maybe a particular, situation or story you'd like to share, how it was really
Oh,
helpful for
certainly.
somebody and improved their life?
Certainly, many autoimmune diseases are caused from too low of a pH level, and that's known through research and through chemistry and physiology. It's something that the physicians don't really focus on yet at this time, and I'm trying to broaden that viewpoint because from an epidemic viewpoint, we do see groups of people in regions where these type of immune system disorders are increasing, and some other areas that they're not increasing at all. And there is a difference in pH level in the people in those areas, in those regions. So, me personally, one of my patients that I've recently seen, and this has been repetitive with my patients, different patients that I've seen. Um, in this case, her pH level was 6.3, and it should be around 7 to 7.2. And you never want to go to any broad end of those scales because you can end up with acidosis or alkalosis. And, you know, this bit about, oh, it's got to be higher and higher. And no, you don't want to end up with alkalosis. It can cause depression in that type of scenario. And this is a known in medicine. But with the too low of pH level, what your body becomes so acidic, it starts attacking its own cells. Now, whether it's your tendons or the tissue or the skin in general, it can be different areas, but it's when you put any acid on human cells, you're going to get a reaction, and it's usually not a positive one. So I talked to her, and she wanted to try raising her pH, and I gave her some holistic ideas. This is how you can raise it. Please, talk to your doctor about it. I gave her the information. She brought it to her doctor. Her doctor was like, okay, just try it. There wasn't really much else that could be done in her situation. So I think the doctor was very open-minded about it, and she raised it, and all of a sudden she didn't need as many transfusions, and her body stopped attacking. In her case, it was her blood. So her body stopped attack, not didn't stop, it slowed down the attack on her red blood cells. So that was a very positive effect. Now, like I said, any type of things that we mentioned, please talk to your medical professional. If they'd like to give us a call, you can give me a call anytime, 715-892-7500. I'm more than welcome. I welcome their questions, their concerns. If they want the research on it, I can always send that and forward it on to them. So
I
either
found in
way.
my home care patients, traditional medical patients,
Mhm.
walk into a home for the first time, and on their own, they're trying different holistic things. And I'm looking
Yeah.
at their traditional medicine list. And, is your doctor aware of what you're doing? And the answer I usually get, oh, I can't tell the doctor; he'll be mad at me. And doctors are not like a parent that is going to discipline
Yeah.
you if you don't do. And one example, which I love this particular doctor, even though when I sought him out because he was an infectious disease doctor when I first was
Mhm.
diagnosed with the Lyme disease. And my first go-to was some of the holistic infusions that are out there. One of the nation's experts was in DC, not too far from Philadelphia. But I still wanted to touch base, see what do you think? Because I'm also allergic to a lot of antibiotics, so that's risky by itself. And I described what I wanted to do, and he took a step back. He was a young guy at the time, and very politely said to me, "The philosophies that you are describing are not expressed in the pews of the church I attend." And
Wow.
I thought that's the nicest way of getting rejected I've ever had. And
Interesting
just a
perspective too.
he was very respectful. He wasn't telling me not
Mhm.
to. He just said in a very nice way. And so fast forward 20 years now, because I've been dealing with I had him recently. I had a kidney stone issue a couple years ago, and I requested him at the hospital, and I reminded
Mhm.
him what he had said 20 years ago. And he kind of laughed. He says, "Yeah, it sounds like something I would have said." He said, I've opened my mind a little bit more, but bottom line is the germs got to get killed.
Yeah.
Uh,
Yeah.
but, and you talk about the side effects with the herbal stuff. The average person, when they get to the hospital or with their family doctor, you've got your blood pressure medicines, your asthma medicines, your, name it, you've got
Mhm.
it. And then on top of that, they're giving you Prilosec or Prevacid to counteract the side effects of your medicines because they know the
Yep.
medicines are going to cause side effects. If you have side effects, you have less compliance with the average person in both traditional or other. If somebody's having a problem with their traditional blood pressure medicine, and I know they can't be without it, if they only
Right.
take it once a day, I'll suggest take it at bedtime. And the worst side effects that you're feeling will be gone by the time you wake up and the medicine's still working.
Yep.
So a lot of times it's just simple things like changing the schedule even, or, learning more about how your medicine works, and you realize, well, gosh, I get sick every time I eat this food. It's because I'm not supposed to take that pill with food or milk. Um,
Yep. They
and,
need to know that, right?
so it's a lot about educating, but I really stress to people that you are in total control of your health care. Um, and you should be working as a collaborative team with your doctor. They are not God, they can't read your mind, and they
Right.
actually appreciate having a patient that has done a little bit of. I'm not a fan of Dr. Google myself, but at times it helps.
Yeah.
But the doctor appreciates that somebody's really trying to learn and get ahead of the thing and participate in the process. Because if they're participating, then they're invested, and a lot of times it's just that investment for your own sustainability, to use your term, is what
Right.
makes the process work.
Yeah.
You're more trustworthy. You feel empowered to help yourself, and you're just kind of physician heal thyself, faith healers. It's all about, feeling empowerment that you're not a helpless victim of the healthcare system.
Right.
Um, so,
Absolutely.
uh,
It's teamwork that counts. And you have to inform your team, just like in business. You need to inform your team so you'll hold all the team participants know what's going on so they can make a more educated decision with their choices and how to treat you. It's very important that your healthcare professional knows all the different things you're doing and be honest with them, right? Be honest
I
because
mean,
after all,
they're not gonna stop being your doctor, unless it's
yeah,
a
and
really
just tell them, "Look,
nice.
I like a combination of everything, and this is what I do, and, I'm open to Western medicine, but please also, keep in mind what I'm doing holistically, and please, by all means, give me your opinion," because after all, they can add in probably a lot of insight that maybe you didn't know about.
Well, I think not only learning the integrative techniques are modern residents and
Mhm.
interns, they're actually learning to listen to the patient. And when
Right.
doctors first were told to get on the electronic medium and they had their iPads or little laptops, uh, older doctors that could afford it would pay a person to sit there and type, and he would just dictate like the old days. But
Right.
sometimes the newer
Remember
doctors, they're
that.
like just staring at their iPad. I went to a appointment with my husband years ago. The doctor was brand new to the electronic then. He was a good doctor. I'd known him for years. He didn't look at my
Mhm.
husband once. Every question was in the screen, and never looked at him. Sometimes when a patient says something, their nonverbal behavior is the real answer to the question. And
Well, right. I think nowadays we have a lot of young doctors, and some are not finished with medical school, some are still learning, maybe in the middle of clinicals. We've broadened the scope of what doctors can be today, and we needed that, especially from all the things that have been going on over the last 10 years. So, they do use the internet, to check on different things. However, keep in mind that um, I do believe their sources are more accurate than, say, just AI. So they have more accurate sources than we would just going on looking in AI. And that's, something viewers need to understand. You're still going to have some errors in AI, but doesn't mean that's what the doctor's looking at.
right, and I'm
Mhm.
fortunate as a nurse, and the reason I get a lot of the kind of clients I get is because I am a nurse, and nurses
Right.
seem to be more relatable than doctors are, because they don't see us as God as much as they see the doctor,
You're more
and
personable for sure than most doctors
we have
I've
the
ever met.
ability to spend time. My doctor,
Yeah.
who's an integrative medicine physician, told me that if she spends more than 15 minutes on, say, a Medicare patient, she gets reimbursed less than she would be if she was spending,
Oh.
like they penalize her for
Mhm.
spending more time than they give her that little slot, and
Right.
it's hard for doctors. A lot of times they feel like they can't even be a doctor anymore. Just
Yeah.
like, teachers used to be able to pat you on the back, say, hi, good job, and now teachers are afraid to touch their students and because of the implications if
Can't
somebody
even give
gets
them a hug, a
what,
heartfelt hug.
and
But
so those kind of changes in society, they affect all aspects. But uh,
yeah.
we had the
Yeah, I
new influx of private equity taking over
mhm.
healthcare decisions, and
Yes.
that's where
Mhm.
we come in because we help educate. Uh,
Right. Yep. And then we educate and we send them back to their doctor or physician or medical practitioner, and we basically give them extra tools to consider in their entourage of what they're doing in their treatment.
I
So,
met a woman yesterday who's just, and she's young, she's in her 40s, diagnosed with colon cancer, and that's becoming a rising epidemic with, that population now.
yeah,
And so she was looking on her own for, she's scared to death of chemo, scared of the diagnosis. You're only 40 and you have to think about, your whole
mm,
life. And I told her that she has to start by being grateful, first of all, that it was diagnosed, early, and also understand and learn that your diagnosis, your disease, or whatever you're dealing with is not who you are. It's not your identity. And so many times with chronic illnesses, I find that the patient doesn't see themselves as the whole person they are. They see themselves as, I'm frozen in life. I have fibromyalgia. I can't, I can't move. I can't
right,
do anything. So it's to be holistic, you have to really encompass all of those things. And I think once you just realize that your identity is not your illness, feel
right.
more empowered just with that choice.
It's so common they identify with their illness. And you're right, that's not the person they are. That's just something regarding their physical being, and mentally you know, it's not the actual person. Maybe a lesson to learn as a person, I'm not sure. That's between them and their beliefs, but I
Well,
don't
we know
know.
that science has proven when you talk about the pH issues, certain cancers cannot exist in certain
Correct.
environments. So that's one reason why we work with diet things to change the pH so your
Yeah.
cancer can't survive. And there's other illnesses too that have the same thing. Um, Certain medical procedures, say somebody that has gastric bypass, they need to understand that the way they rearrange your innards, you can no longer actually get the vitamins and things from what looks like healthy meals that you thought. You've changed your lifestyle, you're eating healthy. You still need to take vitamins for the rest of your life because you will be vitamin nutrition deficient if you don't.
Dependent too. Mhm.
Um, so I think we're just trying to just educate, and it's such a crazy world. People don't know the prices are going up. We're not necessarily less expensive than some of those pharmaceuticals. But if you are prescribed an expensive pharmaceutical drug, especially these specialty pharmacies that, autoimmune
Put it
people often
together.
get,
Yeah.
every pharmacy that manufactures these medications offers copay assistance. Nobody, I have a friend who has MS. Her first month of the year, it's $5,000 for her copay, and she can't afford that.
No.
But there is help. The pharmaceutical manufacturer knows that the average person can't
The
afford
Orphan
that.
Drug Act. Yeah,
Yeah.
it covers everybody who needs a prescription or something unique and very rare that it's not on the mass market for pharmaceuticals. So what they do is through the Orphan Drug Act, they can charge a lower amount than what they normally would to various patients. And it's a lot of it can be based on any drug can be based on your income. So you can apply to different pharmaceutical companies to get a lower price on any drug. So there are programs out there. It's just a lot of people don't are unaware of them, and hopefully we can change that.
That's a big point. I mean, even one of the medicines that they wanted me to take post cataract, they started off, well, this is going to be $800 a month copay, and I said, well, no, it's not. I said, let's talk about what assistance do you have for copay
Right.
assistance.
Yeah. Who's the company? Let's get on there. Yeah.
I mean,
Yeah.
they make enough money, that they have some wiggle room to offer people that would not have a normal life otherwise,
And
or
they
might
do.
not even
They
have a
do.
life.
Yeah. For an example, one of the drugs my mother was taking, it was 800 and something a month. And I was like, what? So I called the company, and she was like $200 over the maximum amount you can earn to get the, you know, less amount. But then we did that, was it um Pharmax or something online or whatever, and then she ended up getting it for like $400 for 2 months, and I mean, it really brought it down. So there's other types of programs out there too that are not pharmaceutical based, but they're like brokers of pharmaceuticals that they can actually get you the cost down. And so it's, there's many different ways, but it's just letting them know. I'm sure you run across that a lot though, when people can't afford those type of medications, and just trying to help guide them to how to bring that cost down, and maybe subsidizing some of the medication for other nutrients, but at the same time, I mean, you're so experienced with that type of thing,
One of the
especially,
things I learned with long-term care patients is that
Mhm.
apparently, and I don't know the specifics of the agreements, but Medicare and Medicaid have agreements with, I guess, the nursing home pharmacies to try the latest and best and greatest drug, which sometimes is just a remixture of the same old drug, or it's a combination of two very good, very old drugs that are very cheap.
Right, they call it
Uh,
next generation.
right.
So, yeah.
And but then if the patient doesn't stay long term and maybe goes home after a short-term rehab, after a knee replacement or something, and say
Mhm.
they're a diabetic and in the facility they're getting the best, latest drug there is out there, or blood pressure, you're getting one of the combination drugs. One man in particular, he was discharged and he was told by the pharmacy, "Oh, it's gonna cost you 900 a month." He wasn't even working. He
Oof.
wa didn't even have disability yet. So
Mm.
he didn't tell his doctor, he just didn't take his medicine. And, when and he just happened to mention it, I said, "Were you able to get all your prescriptions after you got home?" And then he told me, and, I said, "You need to call your doctor and say, 'Give me the 2 drugs that make up that big expensive drug. I'll take 2 drugs that cost me $10 a bottle instead of, 900 a bottle.'"
Yep.
So there's always options. Doctors don't always know the best ways to get around that, but the
True.
nurse in the doctor's office usually does. And certainly the pharmaceutical manufacturer, you can go online to see who makes your drug and talk to them. They have consumer experts that help you with that. Um,
Yes.
so,
Yep.
so that's what we
Or
look
they could
at
give it to you
holistic.
for less.
Yeah. So what would you like to to share with us? We threw a lot of information out here today. We're getting, close to the end. Would you like to kind of
Right.
summarize or offer, gems of pearls of life that get you through this crazy world?
Well, let me just make it clear to our viewers. I think the points we're trying to get across are: be open with your communication to your healthcare professional. You may think that they don't want to hear it. Whether they do or don't, it's your life. You be self sustainable. You make your own decisions. But be open with them so that they can prescribe the right medications, because you could be on one herbal medicine that counteracts with a prescription medication. So they also need to know what not to prescribe you. If they don't want to give you too many anti-inflammatories if you're taking 1,500 milligrams of turmeric 3 times a day, and then
Right.
prescribe an anti-inflammatory. Obviously, that's not what you need. So they need to know what you're taking, what you're doing for your self-sustainability at home. You can just say, "Hey, I'm from a long line of people for home care, and this is how we do it." And they usually do respect that, though. I have only run across a couple physicians that were against that. The other thing is cost of medications. If some medications or even herbs, but mostly medications, there is the Orphan Drug Act for cancer patients and unusual diseases, especially autoimmune diseases. There is some type of system set up to lower the cost of your medications. And this has been set up for decades. It's not new, it's there. It's just knowing, check with the pharmaceutical company that is making the medication. You will find that they almost all of them have a form you can fill out and submit it to get a lower cost on that drug. Um, Always, consider various types of alternative integrative medicine, but at the same time, just open communication with your healthcare practitioner. So
And it's
definitely.
important that all your doctors communicate with each other. Like, say if you're somebody that it's common knowledge,
Mhm.
fish oil, for instance, is good for the heart. It helps with depression, things like that. But if you're going to have carpal tunnel surgery or even cataract surgery. You've got to stop your fish oil like a week or
Right.
so before, because it could cause bleeding issues in the surgery
The
and
blood
complications.
thinner. Yeah.
So, and a
Absolutely.
lot of diet considerations with different, not just, the coumadin and the
Yes.
green leafy vitamin K issues, but there's a lot of medications that interact with food. Certain times of the year, maybe if you're not someone who drinks enough water, none of us drink enough water, but when it's really hot, like here in Philadelphia, it's been, real field temperature of 105 with 50% humidity all week. Your body ends up getting a toxic level of the drugs. It sits in your body longer. The medicine always gets processed through your kidneys and liver. If it sits there too long, you know, just like pouring acid on your body, it's
Yeah, it
going
can
to,
get trapped in the tissue.
yeah.
Also, because it's been so hot, something else to consider, drinking water is just gonna flush out your electrolytes if you're not sweating it out. But either way, you're replacing it with more water and you're still dropping down your potassium levels, sodium levels, glucose levels. Maybe you need your glucose drop, but at the same time, maybe your heart would really appreciate a little extra potassium or electrolytes. So in the real hot sweat, like especially farm workers nowadays, it's one of the hardest things they have. They get heart palpitations and everything. First thing I say is drink some Gatorade, drink some Powerade, drink something that has electrolytes where it has the glucose and the potassium and the sodium, but at the levels your body can handle. Yes, in times of emergency or on front lines in at wartime, you can take a pinch of salt, pinch of sugar, and give them. That's one thing. But we're talking, in today's day and age, go grab something that's already made. You can chug it. It's there for you, but you cannot retain the fluid just by drinking water. It will go right through you, and you can end up with drug toxicity in the cellular tissue because it's not getting into the cellular tissue without your potassium and your sodium and something to help retain some of that liquid in your system. So you can still get heat exhaustion, you can still get dehydration even if you're drinking water. What I tell people is have some bouillon or something. You just add something, because it's not going to work otherwise. I know I've had quite a few clients actually I used to get from Russia, and they would be like, no, 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 don't drink water. And they were into, broth, and broth is fine. But at the same time, um, you know, you just mix it up and make sure to have enough electrolytes in the drinks that you drink.
And for what we're finding with, diabetes is one of the nation's biggest problems right
Mm,
now, challenges.
yeah,
And many diabetics have circulation problems, and they end up losing a limb, or have other issues like that, or they have
yeah,
heart problems, need the bypass surgery, taking good veins out of their legs to survive the heart. But if you're getting to where you're close to kidney failure or even chronic kidney disease, but not bad enough for dialysis, you need to be able ask your doctor or somebody you trust that's in the medical field, how do I change my life now? Because I know I can't drink gallons of water.
right.
Uh, it'll hurt my heart, and my kidneys can't flush it anymore that well. So there's no stupid questions to ask,
No.
and there's really even
Mm,
my doctor, if she didn't know something, she'll look it up, and
absolutely.
you know,
We're all
um,
human.
yeah. So there's just a lot, you can take responsibility for your health but that doesn't mean never see your doctor, never, you do
Right.
need regular. I mean, my dogs and my parrots get annual blood work.
Mhm.
The parrot gets like geriatric
Wow,
blood
that's
work
an
twice a year.
unusual one. I never heard of that one. That's pretty cool.
Well, they're
Or
macaws and African greys. Big
yeah,
parrots need blood work
didn't know
just
they
like
did that.
so you do need some baseline information for the doctor to make an educated decision. And sometimes that annual blood work actually gives you early signs, that you better talk to
Yes,
somebody, that you weren't aware you had a
very
problem.
important.
So, um, well, I really appreciate these last 2 days with you. We can follow on our YouTube channels. Dr. Gloria Warren has her own channel, and that's where yesterday's show is. She'll talk about the reading that she gave me, which was surprisingly accurate. And the whole both topics together, we kind of combine these so that we could cover more on the same thing, because this topic will never end be without material. But
Right.
the message here is you are in control of your life, and you need to be proactive and talk to your doctor like he's a peer. You know, he has extra education, but so thank everybody for coming today. Thank you, Gloria. I'm glad we had a
Thank you.
chance to meet this way. And as I'm looking at it, we're in the middle of a lightning thunderstorm, so I'm going to get off the internet and wish everybody a good week. I'll be back next Thursday, 1 o'clock Eastern Standard Time. And everybody have a good, healthy week. Take care.
Thanks.
Bye
Bye.
bye.
This has been The Holistic Nurse with host Peggy Smith. Tune in each week where you're encouraged to send in questions and receive private responses and suggestions if appropriate. Thursdays, 1 p.m. Eastern.